All right, good afternoon, everyone. I want to say thank you for coming to our webinar today. I am Corbin Granger, and with me is
Barbara Jennings.
And we are going to take some time today to talk about two really important rules that you may not have heard a lot about. This represents some of the greatest changes to the health insurance market, mainly in consumer tools and patient protections since the Affordable Care Act. And so we wanted to review these today for a couple of reasons. Even though you are sitting here as a result of an employer-sponsored plan, and these have consumer protections, we feel it's very important for a number of reasons. One is all of us are invested in the cost of healthcare. And so a lot of the protections that we'll go over today help manage the cost and help control cost while allowing individuals to seek out the providers that they want to use. Second of all, and I think Barbara and I have talked about this for a number of times, is if any of you remember the HMOs and we went to a strict co-payment provision, you have a baby, it's $300, you go to your primary care, it's $25, a specialist is $50. That was also a cost containment provision, but that really divorced us from the true cost of healthcare. And now the world has kind of flipped, and we're looking at higher deductibles, higher out-of-pockets. So as we can manage those expenses for ourselves and our families, I think that will be a good thing. Second of all, like with any large legislation or rule change, it's going to take a while for some of this to shake out between state law and federal law. And so we may have situations where you can help your employees with the claim, or we can step in and help you with the Affordable Care Act. You'll remember preventive care was covered at 100%, but really for about a year, many doctors and providers were using the wrong diagnosis code. So it was processed not as preventive care, but as something else. And so we helped assist with those claims. So we think this information is going to be incredibly useful on a number of different levels. And with that,
yeah, if I could interject one thing
yes.
in here, I think that this is one of those laws that it's confusing and there's a lot to it, but ultimately, I think the provisions of this law are going to be welcomed by your employees and you as well. I don't know if we've got anybody on here who's attended any of my webinars on human resources. That's typically my specialty, but it's never fun as a benefits administrator to have an employee come walking down the hallway waving papers at you and wanting to know why does my employee have to pay for this amount, and why are they being billed for something that they don't understand? And I think that's kind of a summary of what this aims to prevent and hopefully make everybody's life a little easier, except I guess the insurance companies.
Yeah, that's right. So they have to figure all this out.
Yeah.
And just a little bit of housekeeping. We are going to go ahead and go through the presentation. You're welcome, if you have a question, to put it in the chat box, and we will handle any questions at the end. We have also attached a copy of the presentation to this meeting, but we also are going to send it out in the next day or so to everyone who registered, not all attendees, but everyone who registered. So if anybody, if you have a coworker that couldn't attend, we'll send that to them as well. So here is our disclaimer. As you know, this is a staple of every presentation. The information in this presentation is definitely going to change simply because there's going to be rulemaking down the road, but the substance is really the same. And when we're going through this today, our goal is to create a foundation of what the rules look like. We're not going to dive into every detail of every rule. nor are we going to gloss over everything. So our goal for you is to have a good foundation on the rules. And if you have any specific legal or tax questions, I know I'm not an attorney. Barbara, are you an attorney?
No, as much as I might have wanted to be one day back in the day, no,
right.
I'm not.
So we're not attorneys, so I think it would be really cool if we had that Law and Order music follow us around. The dun, dun. But if you, in all seriousness, if you have a serious question that relates to your particular circumstance, please reach out to your counsel or a tax advisor.
Right, never hesitate to call an attorney. And there's some situations where, you know, just for your own good, it's better to have an expert weigh in on some of your questions.
Okay, so the first one is the No Surprises Act. As a reminder, the No Surprises Act is a federal law, and that is important because a number of states also have laws that protect against balance billing, including Virginia. So in administering this federal law, insurance companies are also going to be dividing up balance billing concerns or claims, whether it's administered under the state law or the federal law, and that will fill in some gaps. So it provides balance, it prohibits balance billing for emergency care from out-of-network providers or facilities. And so let me back up a second. And what is balance billing? At least one in every 4 claims, I think, results in some balance billing. And so you may go to an in-network facility and have surgery, but unbeknownst to you, the anesthesiologist that they have that day is out of network. And so you get, surprise, a bill for a balance bill for the amount that the anesthesiologist charges because they're not tied to the in-network contract price.
Right, so there's a gap
surgery
between the in-network approved amount and what the anesthesiologist would normally charge, is what I guess you'd call it, a retail rate or
absolutely.
that sort of thing.
So emergency care is really already handled under the ACA. Non-emergency care from an out-of-network provider in an in-network facility. So this expands some of those provisions quite a lot. And out-of-network air ambulance care. Air ambulance, well, first of all, it's very, very important if you have a situation where somebody needs to be taken by air ambulance, and that's just not the time to try to decide if they're in or out of network. And those claims have gotten really expensive, easily north of $40,000 or $50,000 in some cases. And so the federal government is the only one who can regulate air travel. So all air ambulances are now going to be reimbursed as if it was in network. And that represents a substantial savings in what is probably the worst day of your life.
More ways than one.
Right. So the No Surprises Act also, it applies to self-insured plans that did not opt in to a state's balance billing law. So for example, in Virginia, we have a state no balance billing law that came into effect last year, but self-insured plans are not regulated by the state. So unless they chose to opt in, which most do not for various reasons, they will only the No Surprises Act will come up in those circumstances. You're going to have expanded surprise billing protections for fully insured plans when a state balance billing law does not apply. So for example, the emergency for why you need to be taken out by air ambulance will be covered in network based on the state's balance billing law, but the air ambulance itself will be covered under the No Surprises Act.
So any HR person who is responsible for human resources and benefits, right now on the human resources side, we already have to contend with federal laws and state laws,
right?
And have to make certain that, you know, if we have Virginia employees or North Carolina employees, there may be a different set of rules. And so you're really talking about the same thing under this law, that you may have a state law that is also out there in addition to the federal law. And I think am I correct on this, that eventually we're going to see how that plays out, or we will be getting more guidance along the way, I assume, about how they kind of work with each other, if they work with each other?
Right. I think just what we were saying about the ACA, it'll just take a little bit for the dust to settle. So the carriers already know in Virginia they have to comply with the Virginia law. But yeah, you could have one claim, but it's going to be handled under two different provisions based upon, you know, what the issue is. Did that explain it?
Yes, that makes sense to me. It doesn't make it any easier, but yeah, it makes sense.
And also the No Surprises Act, which ties into the transparency and coverage rules. It also requires plans to develop and maintain these price transparency tools, which we feel are going to be effective, and I will show you why. Some of them, not all. Good faith estimates, so you have an idea of what the cost is going to be before scheduling that service, and advanced explanation of benefits and certain other provisions. So with the transparency and coverage rules, these are also federal rules, and they require insurers and health plans to provide personalized information on their cost sharing for specific covered items and services before you receive care. Now, many of you may be familiar with the generic price comparison tools that your carrier has out there today. I think Anthem has a Sydney app and some other ones, but these are very general tools. The goal of these rules is to provide personal information. So based upon your plan, your out-of-pocket, what are we looking at in terms of cost? Now, this isn't only going to lower your consumer healthcare costs because you have the opportunity to shop for healthcare, which really no one has done in many years.
Right.
You know, I mean, we all shop for everything, like washing machines, refrigerators, new kitchens, what have you. But, you know, healthcare, more times than not, people have just always gone where their doctor told them to go.
Exactly. You have to have a lot of faith that you're being given good guidance, and now this is going to help that.
Yes, it's going to help.
All is said and done.
It's going to help that a lot. For example, let's say your doctor says you need an MRI, and they say, oh, we'll just go to the hospital. Well, first of all, if anybody tells my 84-year-old mother, the doctor, to go to the hospital, she's only going to the hospital.
Going, yeah.
So I'm not talking necessarily about her today. But if you walk into the hospital, the cost just generally jumps about $2,000 versus going to a freestanding facility where it is closer to $700. And all things being equal, I'd rather apply my deductible and coinsurance to the $700 than the $2,800.
Absolutely.
It's also going to increase, we believe, competition, because now providers are actually going to see other providers' charges. It's very easy to look up and different charges. And so in order to remain competitive, you know, providers are going to have to be doing something consistent with what the median rate is in the area. And this applies to all of your individual, fully insured and self-insured plans. Little policies like travel policies or some of these short-term policies, it does not apply to, doesn't apply to standalone dental or vision. So we're really talking health here.
Right. The big ticket items, bigger ticket items.
So transparency and coverage rules actually have two provisions. It's called machine readable files and the consumer price transparency tool. And that sounds like a lot of fun. And I would like to sign off to you, Barbara, at this point in time.
Since I enjoy saying machine readable files a lot. No, just kidding. Okay, so we're talking about a lot of data here, right?
Yes.
I mean, and not just a lot of data, but data that's potentially going to change regularly. All right, so how in the world do they manage all that data? What is going to be required is that basically the health insurance plans are going to have to provide, as you see these little bulleted points, negotiated rates for covered plan services and items for in-network providers, historical payments to and bill charges from out-of-network providers. That all by itself sounds like a lot. And then in-network negotiated rates for all covered prescription drugs. Now that has been delayed. I'm not sure to when. Do you know when that?
So it's, they're saying that rules are anticipated to come out in 2022.
Okay.
And the reason is the No Surprises Act also requires a lot of reporting as it relates to prescription drugs. So they're going to try to align the two sets of rules and make one.
Okay. So, but there may not be a switch flipped on July 1st that has all that data.
Right.
Okay.
There definitely won't. Yes.
So, how are they going to, how's all that going to be uploaded and stuff? So the requirement is that everything be in a machine readable form. And there's anyone who's done Excel spreadsheets is probably familiar with what's called comma separated values, where you basically, that's exactly what it sounds like. It's values that are separated by commas that you can upload, like certain like payroll reports, you can upload things into payroll. So you're familiar probably with technically what a machine readable file is, a digital representation of data. Now, luckily, most of the responsibility of this is going to fall on the insurance companies, right? If you're fully insured.
Yes, correct.
Now, you may have a bigger burden if you're self-insured. Is that
right?
A true statement?
Yes.
Okay.
Depending on the nature of it. So, and this is why we're trying to do this now, because as your broker is going to talk to you, if you have an ASO, administrative services only or self-funded format, they're going to be talking to you about this a little bit. If there's anything necessary that you need to request from your vendors,
right,
or that they will request for you.
The fully insured plans, though, hopefully the way this is going to work is that your employees are going to end up being the beneficiaries of all of this information, and you as the employer are not going to be stuck with having to jump through all these hoops to make it happen.
No, I mean, definitely not. These files are actually going to be massive. And when I say transparency tools that are going to help you, we don't really envision this as the truly helpful tool. This is more of a data dump, and our sources more in the know have said that they realize under this legislation that it is a massive data dump, but they're really looking eventually for somebody to aggregate it and put it in an app and market it to all of us.
So could that eventually be like on your phone?
Yeah, exactly. That would probably be the way this would go.
Eventually, yes. But actually, I can imagine that somebody's just, the July 1st date is out there. So obviously you've got insurance companies working away on this already. But one other good thing I think that your employees are going to benefit from is the rules require that this information be available, and there can't be a lot of barriers to employees accessing this. So in other words, no passwords, no email stuff, no identifying info in order to access a lot of this information. So that's another piece of good news.
Yes. So the second piece of this is the consumer price transparency tool. And this one is really geared more to your plan, your cost. So the issuer is going to create an online tool, and really most of them are just modifying the tools they have today to be able to put this information up there in a personalized format, so that you could, let's say you needed to go see a pulmonologist and you wanted to know, you wanted to compare two pulmonologists in the area. Well, you should be able to look them up. You can do it based on the billing code or a description of the service or doctor. You actually can compare in-network and out-of-network costs. It's going to have personalized information about your accumulated deductible and other costs. Other things that might impact the cost, such as the drug dosage or the service location. I think thereof, if anybody's ever used GoodRx, you can search for a drug, but the dosage of the drug makes a difference.
Right.
in the cost. And of course, you can get it in paper. So the way this is going to work is this is going to start January 1, 2023 for roughly 500 items and services that are going to be predetermined, including prescriptions. So even though the prescription information was delayed for the machine readable file, it is supposed to be up here for the consumer price transparency tool.
So in other words, on January 1st of 23, you're not going to have a complete access to everything that could be out there.
Correct.
Right. And maybe like the most common prescriptions
Right.
and services and that sort of thing. And then at some point along the way, they're going to just like ease into adding.
Yes, by the next year, they have to have everything.
Oh, okay.
And actually, there is currently a requirement for all hospitals to have their services listed and be able to be searched. But, you know, hospitals, again, you guys can see how enormous this provision is. And so with COVID and everything else, their compliance rate is closer to about 60% on their end of it, simply because, you know, it's just a monumental amount of data.
Right.
But again, once it's up and running, I mean, that would truly help me to determine, you know, if I hear a doctor is the best, but they're in, I don't know, in what, Mayo Clinic, versus someone who's completely out of network versus someone's here, maybe I can do, you know, I could compare the in-network versus the out-of-network cost, which could be very helpful. And it may, you know, bear out that I want to go out of network or I stay in network. But the idea is you're going to have actual power over what you're looking at. And so I think of it as shopping,
Right.
you know, almost like using your Kroger app. You put things in your, or Amazon, you put things in your basket and then you compare them and it'll pull up other things. So this is really supposed to be consumer friendly.
So I can add my appendectomy to my cart.
That's right. You can add your appendectomy to your cart. That's exactly right. So now so the transparency and coverage rules are really those two sections, having the machine readable files, which is just a big data dump, and then the consumer price transparency tool, which I think is going to evolve into something that people really use. People just need to learn and know where it is. And I think that's where employers can help, because if you get in the habit, you know, if you have a $3,000 deductible, you're going to be much more inclined to look and find, you know, the most cost-effective provider or service or medication. So I think it's very important.
Yeah, and really, as employers, I think educating yourself on how these things work is just going to be a huge help. I mean, you know, you're a consumer as well. As an HR and benefits person. And so being able to guide your employees, I think is just going to be a real kind of value added service. And, you know, it may be a stretch to say that it could just help you with your recruiting and retention, but certainly being a resource for employees to be able to answer their questions and help them certainly gives, you know, warm and fuzzy to your employees that you care about them and that you are always willing to step up and help. So anyway, I would encourage all employers to educate themselves on, you know, everything they can know about this to be helpful.
Thank you. And so we're going to shift gears a little bit to, you'll see that term, Consolidated Appropriations Act. And that was actually a law that was passed last year in the previous administration, but under what's called Title I is the No Surprises Act. And some of this has already come to fruition, but a lot of it is pending more rulemaking. And so this is going to be something that's going to evolve over time as well. This law is also designed to improve transparency and costs and really prevent, not eliminate altogether, and we'll show you some situations where you can be subject to balance billing, but it's really designed to prevent those surprise medical bills and the balance billing situation, especially as 9 times out of 10 you didn't even know you're receiving care from an out-of-network provider. All right, so the surprise medical billing, and we'll go into that in a little more detail in other slides, but it requires plans and issuers to cover out-of-network providers that are in network facilities as in-network for emergencies and other non-emergency care. So if you choose to go to a provider that is out-of-network and in an out-of-network facility, and you sign the consent that they will provide you, then that will be a situation where you could still be balance billed. But for emergencies and for many other non-emergency care situations, it has to be covered as in network. And that went into effect January 1, 2022. As we referenced air ambulances, those will be covered as in-network, and the air ambulance company also has to do a certain amount of reporting. Now, those two issues are really consumer issues. So limiting your cost as a consumer under the surprise medical billing and air ambulance provision. The next item on the list is called the independent dispute resolution, or IDR. So while you as a consumer, so Barbara, if you went to the hospital and there was a situation where it was $1,000 out-of-network provider, you would not be subject to that balance billing. You would just be subject to whatever the in-network rate was.
Right.
But somehow the out-of-network provider and the insurance carrier have to get together and determine what the payment is going to be to that out-of-network provider. And what happens is, I believe the carrier will make an offer. If that's not disputed in 30 days, then that's accepted. But if the provider chooses not to accept it, the out-of-network provider, then the carrier and the out-of-network provider go through a dispute resolution process. And there have been some class action lawsuits against this process because insurance companies have a lot of clout, right? And so if they're allowed to dictate what the main rate is going to be, that the IDR entity looks at, then the out-of-network providers were saying, well, that's not fair.
Right.
They have the law of large numbers in their favor, and they can artificially lower rates so we don't get a fair rate of return. So that process is going to change slightly, but it doesn't change on your end. This is something that happens behind the scenes with the carrier and the out-of-network provider.
So I'm not going to have to arm wrestle anybody to negotiate my fee.
Right, exactly.
What I have to pay.
Exactly. Now, if you have a question, because this is new, and a provider may inadvertently send you a bill, that's why this education is important, because of course you can double check it and have them reconsider it. And there's actually a provision in the law where they are supposed to do an external review to make sure that it's been reimbursed properly.
Right.
ID cards, I think this is a great idea. I know a lot of companies already do this, but you have to show the in and out of network deductibles and the max out of pockets. So if your plan renews on or after January 1, 2022, look for that information on your ID card. So let's see, I'll go to the next slide. Pressure's on. Right. Okay.
We'll have it memorized just in case.
You do? Oh, thank you, Barbara.
That's
all
a
right.
lie.
As you can tell, we have a good rapport, and this is why we want to do this back and forth. We were talking about it, and you just didn't want to hear someone drone on
about such an exciting
topic. So we,
But really, it is exciting.
It is.
It's exciting, particularly if you've ever been in a situation where you've come up with some type of balance bill.
Yes.
I mean, it's really bad to be a patient in a hospital or have surgery or something big in your life And then on top of that, you get some bill for $900 because you didn't know that the anesthesiologist was not in network.
Right.
So in reality, this is a very useful and helpful thing. So.
Absolutely. And that brings us to the next point, which is what's called an advanced explanation of benefits. If anyone ever hasn't received one of these, the explanation of benefits is the document. It's not your bill, but it's the document you get from the health insurance carrier that said your doctor charged X. This is the amount that we will consider, and your responsibility in network or out of network is Y. Now, these always historically have come way after your surgery or after your services.
When you already owe the $900.
Right, when you already owe the money. So having it in advance, and there's some rules about how far in advance they will give them or are required to give them. This really helps prevent, I think, some of that sticker shock, or allows you to plan for some of it, especially after those big surgeries, or even if you have like a voluntary plan, which indemnifies some of your hospital care and critical illness, all of those voluntary products that can help with that. So, because you might know you're going to get a reimbursement for some of that.
Right.
Now, the good faith estimate is the next piece, and you might wonder, well, why do we have a good faith estimate if we have an advanced explanation of benefits? And that's a great question. And the reason is not everyone has insurance. So the good faith estimate provision gives an estimate of costs, even if the person is uninsured. So it allows for those that don't have insurance to understand what their responsibility is going to be, and get into that conversation with the facility. I mean, often if you don't have insurance, they will work out a situation with you.
You can do that in advance, try to figure out a payment plan or whatever rules are.
Last on this slide is the external review of surprise medical bills. And this can be important because this is new. So maybe you get something back that says, no, this doesn't fall under the No Surprises Act or Virginia's balanced billing law. Well, they are required to do an external review if that's the case, and determine if balanced billing protections did apply. And I think that will happen in a couple of cases, as I said, not because people are trying to charge the wrong amount, but just from combining these different bills and laws and the administration of it.
Do you have any idea how that external review is triggered? That might be something we don't even know yet.
Yeah, that is a really good question.
Generally speaking, since most of this protects the consumer, I'm guessing that there's some mechanism for.
Yeah, I think so.
I mean, trigger this.
I know, even today, if you get something like a medication they don't authorize medication, or this isn't covered, right on there they have provisions for what you call the appeal process.
That's true, yeah.
And so this would sort of be like that process.
Right.
Okay. All right, continuity of care. I think, and would you agree, Barbara? I think this is a really important provision. There are some protections already in the Virginia law, but it is a common problem that if someone is going to see a provider that was in network, and then maybe the provider's contract terminated and they're out of network, then the patient, without these continuity of care protections, could be left facing large bills if they stayed with that out-of-network provider.
This is the type of thing you don't think about unless you are in a situation where suddenly you have to think about, whoa, what am I going to do? Like a pregnancy would be an example.
Pregnancy is an example. Terminally ill. And so it's the continuity of care that's required for what they call a serious and complex condition. And that can go up to 90 days. It doesn't have to be the full 90 days, but it can go up to 90 days. And so a serious and complex condition, just so you know, is a condition that's serious enough to require specialized treatment to avoid reasonable possibility of death or serious harm. A chronic illness or condition that is life-threatening, degenerative, potentially disabling, or congenital, and requires prolonged specialized medical care. So like pregnancy, terminally ill, institutional care, any situation like that.
In those specialty situations like that, even though the provider may now be out of network, your plan has to process their bills and pay them as though they were still there.
Yes, and they're required to let you know that the individual is no longer in the network. Right. And then they're required to bill them as if you are, still in network. Oops. Okay. All right, medical, oh, that's a little too efficient. Okay. Medical cost and drug spend reporting. So unfortunately, when you have different arms of the government, in one case it's Congress with the No Surprises Act, then with the transparency and coverage rules, you've got the DOL, the IRS, and HHS. Sometimes there's overlap, and this is one of those situations. So plans are supposed to provide medical cost and drug spend reports to the federal agencies. And so this is really something that will be carried out for fully insured on the carrier level, and probably for AS or self-insured as well, but your broker can speak to you if you have that type of arrangement and they have to outsource this report to you. But if you remember back to the machine readable files and the prescription reporting that was delayed, this relates to this because there's also reporting on prescriptions that are required to the government. So there are pending rulemaking to put all of the provisions together.
Right.
So as of December 27th in 2022, plans are going to send in the information for 2020 and 2021, and then in future years, the report will go out June 1 annually. Okay. The cost comparison tool, again, another duplicate item because it requires health plans to offer a price comparison tool for consumers, be available by phone, but it's almost like the consumer price transparency tool. So they're pending enforcement of this because they want it to align with the requirement January 1, 2023, the date for the consumer price transparency tool, where you can look up 500
right.
services and items, and then the next year you can look up any covered item or service. So these are two areas where they correspond with the transparency and coverage rules. Okay, all right, provider directory information. Now this one is actually quite interesting. This requires health plans to have an up-to-date directory of in-network providers, and plans must verify providers every 90 days. If you as a patient go into a provider that is actually out of network, though the directory indicated they were in network, you are only required to pay the in-network charge. So I think, what were we joking, to take a picture, a screenshot
of the date that you looked up
the person to see if they were. And providers are actually supposed to notify the plan directly as well of their status. Now, one of the interesting things is, even though the provider is required to notify the plan of their in or out of network status, they can have written in their contract that if somebody goes comes to them when they're out of network, but they're listed in network, that the plan, the insurance carrier cover the additional cost.
Wow.
And if you paid the entire bill already, you get reimbursed the bill plus interest.
Oh my gosh. Interesting.
How they're going to figure out interest, I don't know. But
we've come a long way from provider directories in a book, you know.
Right.
How often did you get your new book? Once a year?
Once a year, right. And so this is really a good thing for everyone, because, you know, this happens probably not a lot, but from time to time. And that, again, is not a surprise I'm interested in.
Right.
I mean, I might be interested in a surprise on my birthday if it's something I like, but not like, oh, your provider isn't in the network. Surprise, it's $1,000. Okay. No gag clauses. So, you know, when you ask your doctor, well, what is the cost? And they always say, well, it depends what your insurance pays.
Right.
Right? Because there seems to be this murky land of where things are calculated.
Honestly, medical costs are mysterious.
They are.
Everything's like behind the veil.
Right, behind the green curtain.
Yeah.
And so this is an attempt to pull the curtain back. And so it actually, we all know not all providers are reimbursed the same amount from the carriers. Some providers have more attractive reimbursement rates than others. Other carriers can't do as well in this area because of the contracts that Anthem and Optima get versus, you know, a United Healthcare for the group market. So it all depends upon your geographic area and the contract you've negotiated. So we don't really see, because you have the ability to look up your prices on your price comparison tool, I wouldn't see this as something that I'm going to say, well, let me see, you know, what your provider rates are now that you don't have a gag clause. I think providers are really going to probably look at other providers' reimbursement rates, which again, hopefully is a good thing for all of us because it keeps the landscape competitive. You know, and the more you can peel back that curtain, I think the better for us as consumers.
Right.
Okay. Oh, excuse me. Uh-oh.
There's a delay.
Okay. Okay. Here is the last provision, the last set of provisions. So we all know there's called the Mental Health Parity Program. And what this means is, and I think if COVID has taught us anything, it's the importance of caring for one's mental health and what a stigma that has attached to it. And so the goal is, and this has been a goal for a number of years, if you offer mental health benefits along with your regular hospital, surgical, medical benefits, they have to have some level of parity in them. So if you're taking, let's just say, you know, if someone needs to go inpatient for bipolar for that condition, well, what does it look like on the other side of the coin if you go in inpatient for a surgery?
Right.
How is the parity acquired, medication-wise, all of that? So that's been in play for a number of years. What has gone into effect as of February 10th is this requirement to have a comparative analysis. And what that means is the plan, and here you're going to hear insurance carrier, is going to have an analysis for any what they call non-quantitative treatment limitations. So to compare those treatment limitations against your medical and surgical treatment limitations to make sure that they are aligned and not completely out of whack. Okay. And so if you ever get a question, I think this comes from the Department of Labor, then that is something that can easily be submitted on your behalf. For an ASO or self-insured contract, again, if your broker needs to subcontract that out, there's a method for that too. Now, the last one is what's called the broker compensation disclosure, and this went into effect for retirement plans a few years ago, and so now it's trickling down to health and welfare plans. So we, as your brokers and also consultants, we have to provide to you as the plan sponsor estimates of what all of our indirect and direct compensation of $1,000 or more is going to be. Now, Towne Benefits has taken the position that we're going to provide you a compensation disclosure on every group policy, whether it's 1,000 or not 1,000. And so we're implementing that with all of our April 1 renewals and new contracts. So if you're renewing April or later, you will automatically receive this. If you wanted to receive one for prior to that, we can also make that available to you upon request.
Now, for the most part, this information is already disclosed to the client for the 5,500, but that's historical.
Right, that's
So
historical.
this is
yeah.
prospective. This
Yes.
is disclosure going forward.
Right, prospective. And also too, the Form 5500 is only 100 participants or more,
That's true.
except
Yeah.
in limited circumstances. But yeah, that one is retro and this one is prospective. Thank you. So how is surprise billing handled under the No Surprises Act? So as we've already said, it prohibits providers from balance billing emergency care from out-of-network, non-emergency care from out-of-network providers in an in-network facility, and out-of-network ambulance care. There is a provision, however, out-of-network providers are exempt in certain circumstances, so they can balance bill you if they provide you with proper notice and they obtain the proper consent from you within certain timelines. Okay. So how does an out-of-network provider obtain consent? So the out-of-network provider must use its HHS's Health and Human Services notice and consent forms. These forms must be given together. They can't be embedded in other patient documents. The notice and the consent must be given no later than 72 hours before a scheduled appointment, or if your appointment is sooner, as soon as possible, or at least 3 hours before your appointment if it's on the same day. You have to provide it however the patient wants it, and it must be displayed at their provider's facility and on their websites, unless the provider does not furnish items or services at or connected with a facility. So if you have a doctor that's not even connected with an in-network facility, they don't ever provide services at or in conjunction, then you don't have to provide notice. So to be clear, this is how, if you want to see an out-of-network provider knowing that you're going to be balance billed, they have to let you know that you're going to be balance billed, give you the information regarding it, and you have to sign off and consent to that.
So you can kind of work through that as a practical matter. And I can't come up with an example anyway. I mean, I've known people who have gone to some specialty hospitals like up in New York that don't participate with any, but that's a little different situation.
Right.
So this, anyway.
How about like there's an emergency, your child goes skiing and they break their leg.
Right.
Okay, and they're in Colorado and that's out of network. Well, that's an emergency. They're going to set the cast, set the leg, and that's going to be an emergency.
Got it.
But then they're going to recommend that you have surgery. If you choose to continue with an out-of-network provider,
Got it. Then
a
at that
surgeon,
point,
right, then at that point,
you're going to have to get a disclosure, and
right,
you're going to have to sign it. Okay.
right.
That makes
That's where
perfect
I could think something like
makes
that
perfect sense.
would happen. Or, if you're like me, I would say, son, come home and we'll get it done here.
Right.
So, but that's how it can work. And I think the good point is it's not like, oh, well, we'll see what the insurance pays.
Right.
It's estimating.
Right.
Okay. Now, for more consumer protection, an out-of-network provider cannot provide you notice and consent and be paid out of network in the following situations. If you're receiving an out-of-network service at an in-network facility, and it's related to emergency medicine, anesthesiology, pathology, radiology, neonatology, or diagnostic services like lab services, they cannot balance bill you.
And I think in my experience, that covers everything I've ever seen from an employee who had an unexpected bill. It seemed like it was always
Right.
the anesthesiologist, the radiologist,
Right.
et cetera. So
Yes. So now, what qualifies as a facility? A hospital qualifies, obviously. An independent freestanding emergency department, a hospital outpatient department, what are called critical access hospitals, and those are designations given to eligible rural hospitals by the Center for Medicare and Medicaid, ambulatory surgery centers, and other facilities that HHS will designate. Urgent care centers that are licensed by the state to provide emergency care like a hospital also qualify. But be forewarned, an urgent care facility that's not authorized to provide emergency care, even if the word emergency is in the title, is not a facility. Right. So you could be out of state and go to an urgent care facility, but if it's not authorized by that state, like an emergency authorized to perform emergency services, then it will be considered out of network.
So even if it has emergency clinic or minor emergency clinic on it, it could potentially be an out of network.
Correct, unless they're actually licensed to do that emergency care, certain specific care. So another area is like a retail clinic located inside a drugstore or supermarket, like the CVS Minute Clinics or Walgreens. So your birthing center, hospice facilities, and addiction treatment centers will typically not be covered unless they are affiliated with the hospital. So if you are going to have a baby, for example, and you're going to use a birthing center, I would encourage you to double check and make sure that it will be treated as an in-network facility.
Because it could be a freestanding, privately owned.
Could be freestanding, privately owned. Same with hospice and same with addiction treatment centers. And of course, ground ambulances are also not facilities regulated by the Act. Air ambulances, but not ground ambulances. So let's just go through an example. So a patient goes in for scheduled knee surgery using an in-network surgeon and hospital. The anesthesiologist used for the surgery is out of network. So the in-network allowable charge is $900. This anesthesiologist generally charges about $4,000. Can the anesthesiologist balance bill? No, because the notice and consent provision does not apply for an out-of-network provider at an in-network facility. You can't waive that right away. It also doesn't apply to emergency medicine, pathology, radiology, neonatology, or other diagnostic services. Okay. So it's complicated in its simpleness.
Right.
It's complex in its simplicity.
Underlying all
Right.
that simple language.
Right. So now what if a state has a balance billing law? Well, really, there are about 33 states that have different protections that they call balance billing, no surprise billing. Virginia and North Carolina are included in those. So as we previously mentioned, since the No Surprises Act is a federal law, self-funded plans will mostly be regulated by the No Surprises Act, unless for some reason they opted into the state's balance billing law. So for fully insured plans in states with balance billing protections, it's going to be a coordination of the state and federal law. So for example, an emergency claim may be covered by state law, but if the patient was transported with an air ambulance, the No Surprises Act would apply to the air ambulance services. So you can literally break up a claim, I know, item by item, and how they're going to be,
responsible.
who's going to do what, when, and how. Yes. But that isn't your problem or our problem as consumers. I think it is important, though, just to know that these protections exist in case something isn't processed properly.
Yeah.
But that's never happened, right, Barbara?
Yeah. You really can see as this law is put into practice that you know there are going to be times when things get messed up. And I would urge you to never hesitate to call I'd start probably with the doctor's office. If you have an explanation of benefits and your employee has gotten a bill saying you owe X amount, I'd go back to I think I'd go back to the doctor's office and simply talk to their insurance people and say, okay, can you tell me how this was submitted? Can you explain to me what these payments are and that sort of thing? And because I have found that at the provider level that something has slipped through the cracks, right, and they inadvertently, did not file a claim, and so then they bill you and say you owe this money. In reality, they just need to submit the claim. So that's right, where I would start. And I think also your carrier can often answer questions, and certainly your broker.
Yes, absolutely.
Can help you navigate some of this as well. Yes,
and we're really, I think that's one of the things that is really important to stress here is that we don't like, or our brokers don't like clients to feel like they have to navigate the claims by themselves. That's why your broker is there, and that's why you have a claims team that's able to help you. I think we just had recently a claim that went back, a number of years, and the lady determined to assist with that, got it all rectified. Now it took a little while, but we got it fixed because we have the relationships with all the carriers, and we can get in touch and get things handled for you. It's not something stressful, we want you to have to deal with.
And being surrounded by the client services teams, they do get a lot of satisfaction out of resolving these things. It's like, this is a big win for me today because I got this squared away for somebody.
Because at the end of the day, we're all patients, and we all know how that feels. And so we take a lot of pride in that. Mm-hmm. So I think we're just going to have some final thoughts. Final thought, is it complicated? Yes. Like everything, I wouldn't be doing it if it wasn't complicated, right? You wouldn't hear Barbara nor I if it wasn't complicated. But again, much of the burden falls on insurance carriers and the TPAs for administering these rules. As the employer, understanding the general rules of these laws, I think will help you help your employees and help us all really become better consumers of care. And always remember, we're here to assist you, or if your employees need help with the new rules or any claims, it really is our privilege to provide that service.
Yes, indeed.
So I think now what we'll do is we'll open it up. I can see there might be a question or two. And I'm just going to stop showing the screen just so we don't see. Thank you all so much. Have a great rest of the afternoon. Thank you.